if everyone would do me a huge favor and go ahead and press the mute option that everyone has on their screen so we can make sure we can view the content and engage with everyone via the chat. Perfect. Wow, beautiful turnout. All right. Thank you all so incredibly much for joining us today. Welcome to the January kickoff session for CalAIM's Collaborative Planning and Implementation Group for the San Joaquin and Stanislaus counties. We'd like to let everyone know that this session is being recorded and that we will definitely go ahead and send out a copy of this deck directly after today's session. And if we move to the next slide, I am so excited to share that today's session is being presented by the Department of Healthcare Services in collaboration with Public Consulting Group. As I mentioned earlier at the top of the call, my name is Alexis Taylor. I'll be one of your facilitators today alongside our partners at the Gashow Group. I'm a senior program manager here at Health Begins, and it's our mission to provide healthcare and community partners with the support that they need to improve the social and structural drivers of health equity for both patients and communities. And just to do a quick check for my co-facilitators that we have here today, is it just me on my end of the screen or are the slides progressing? Just to do a quick check with everyone.
They're not progressing on my screen.
All right. Shiva, would we be able to progress to slide number 3? Perfect. Thank you so much. I appreciate it. So as I was saying, we just want to give an incredibly special thank you to the Department of Healthcare Services for funding this incredibly important initiative and for Public Consulting Group for them administering this program. And if we go to the next slide, before we get started today, I'd like to kick off things with some housekeeping items that will make sure we're providing a great foundation to start today's session. First, we'd like to invite everyone to go ahead and update your Zoom name. Please feel more than free to include your pronouns, the name of your organization. We want to make sure that everyone here feels very comfortable. We want to make sure we're getting to know one another because above all, this is going to be an amazing networking space in which we want to make sure that you are leading with, feeling the comfort needed to put forth questions, inquiries, and any type of peer networking that we can go ahead and work towards accomplishing today. Next, we'd like to know more about the makeup of who's here. So we'd like to have a little bit of fun with an emoji-based check-in question. So we want to know, how familiar are you with CalAIM? We know that there are organizations and entities at various stages of CalAIM engagement. Some are in the contracting process, some are in implementation, some are very new to CalAIM and still trying to figure things out, like, what is this CalAIM thing? So if you could use an emoji to let us know where you are in the CalAIM process, that would be incredibly helpful to help us facilitate today and know exactly where everyone in the room is. So if you're someone that's CalAIM curious, go ahead and leave a blue hat in the chat for us right now, meaning that you're curious about what this initiative is. If you're someone that's somewhat familiar, go ahead and leave us a glasses emoji to let us know, like, you know a little bit, but you're still trying to get there. If you are very familiar, go ahead and leave us a graduation cap so we can know exactly how extensive your expertise is. We are looking forward to having an incredibly engaging experience today. And so letting us know exactly where you are with your level of CalAIM familiarity will let us know how we can facilitate today's session. And then lastly, most important, we want to let everyone know that you can engage. Please feel more than free to raise your hand at any time. Please feel more than free to use the chat. And we don't want you to just feel like you have to engage with us, the facilitators. Please engage with one another, exchange contact information, ask questions of those that are currently contracted, that have hubs that are operating well in their region, so on and so forth. So please feel more than free to update your Zoom name, respond to us in the chat with that icebreaker, and most importantly, to engage with both us and the other participants that are here with us today. Moving into the next slide, we'd like to share what our objectives for this session are today. What is CPI? I know this is one of DHCS's brand new initiatives under the PATH funding arm of CalAIM. And so by the end of today's session, we want to make sure that everyone understands the goals of the Collaborative Planning and Implementation Initiative. That's going to be our foremost objective today. Next, we want to make sure that you understand how CPI is going to support your ability to successfully participate in CalAIM. And then lastly, and going back to that entire engage component, we really want to make sure that you have the opportunity to both network and strengthen your relationships with one another, other CalAIM stakeholders, such as plans, providers, and intermediaries. Moving into the next slide, we like to explain precisely how we want to accomplish that today. So in order to reach those objectives that we've set out for the day, we've broken our agenda into 3 distinct sections. We're going to start by setting the stage. So in part 1, we'll discuss a few assumptions about who's here today. We'll do a few rounds of introductions. We'll explain exactly what CPI and what its objectives are. We'll hear some transition statements from some amazing conveners that have been working in the CalAIM space for well over a year now to let you know how we're really building upon the learnings that have taken place throughout 2022 and prior. And we'll make some space for us to discuss how we'll work together to achieve CPI's goals. And we'll also have some space for some reflections. Moving into part 2 of the dialogue, we're going to develop some shared goals. Going back to what I was saying about that entire engage component, unlike technical assistance, unlike prior phases of work that have happened in CalAIM, this specific medium, CPI, is very much so being convened and brought together for you. So this is not going to be an initiative where we, the facilitators and the conveners are just talking, at the participants. We want to make sure that your voices are uplifted. We want to hear from you. We want to share best practices. We want to chronicle challenges, so on and so forth. So the only way that we can do that is by developing some shared goals. So we're going to host an activity for us to design some guiding principles that will outline how we'll spend this time together. We'll do a very quick CalAIM refresher for those organizations that did say they're CalAIM curious, still new to CalAIM, trying to figure out what this is. And then we'll have another activity for us to inform a collective project charter. And we'll break down exactly what that charter is and how we're going to develop some objectives to meet your needs. After that, we'll close out with some reflections and some more Q&A for any outstanding questions that exist. And then we'll let you know specifically what's going to happen in upcoming sessions and provide you with some immediate resources for those that are in the contracting process and or are implementing services. Moving into the next slide. Perfect. Part 1, setting the stage. So setting the stage for today, we'd like to start off with some assumptions about who's here today. So we assume that the individuals and organizations that are here today represent a California-based organization that is involved in CalAIM in some way, shape, or form, and your organization services San Joaquin or Stanislaus counties. We know there had been some previous confusion about, where to register, which collaborative you're supposed to be a part of. So this specific collaborative is for providers and or CalAIM stakeholders that provide services in San Joaquin or Stanislaus counties. Next, your organization is interested in participating in CalAIM, networking with other CalAIM stakeholders, engaging managed care plans, so on and so forth. So specifically, although there are, multiple phases of work that are happening right now that might specifically have to do with another arm of CalAIM, this specific arm is for those entities that are working together specifically to render ECM and or community supports services within the context of CalAIM. Next, very important, you have registered to participate in this collaborative. Some individuals have been forwarded the invite, which is wonderful because we want to make sure that we have a considerable amount of diversity of thought, making sure that we have lots of ideas that are marinating and coming together and amalgamating in the development of solutions. But in order to participate in this collaborative, PATH has to fund your seat. So that means that you need to have registered directly on the CPI website. And if you haven't done so, we've already sent out communications that include that registration link, and we'll make sure to drop that in the chat for you today. Lastly, and most importantly, above all of those, you're committed to improving the lives of Medi-Cal beneficiaries. As we all know, CalAIM is an incredibly transformative approach to just revitalizing what Medi-Cal is. And at the center of that is improving the lives of those beneficiaries. And so moving on to the next slide, we'd like to know a little bit more about you all before we actually dive into our introductions. So we'd like to put forward a poll that should pop up on your screen at any moment now. And what we want to know is, who do you represent? What populations do you serve? Going back to that equity component and making sure that we are convening today, specifically with the goal of improving the lives of Medi-Cal beneficiaries. We want to know specifically the communities that you serve. And so you'll see on your screen that we have Medi-Cal eligible children and adults, dual Medi-Cal and Medicare eligible individuals, BIPOC plus communities, people with limited English proficiency, rural communities, so on and so forth. And so we'll wait until we get about at least 50 to 60% participation before we go ahead and share the results of this poll. And then as I go through that list again, we have individuals with disabilities, those that are experiencing homelessness, adults with serious mental illness, substance abuse disorder, and other underserved populations. And so if everyone can just take a couple of more moments just to go ahead and submit your response to the populations that represent at least 20% of the individuals that you serve, that will be wonderful. And we can go ahead and end that poll and share the results. All right, wow, this is likely one of the most diverse sets of responses that we have seen, wow, over quite some time. We have lots of our individuals that are working with those that are experiencing homelessness. We have dual Medi-Cal and Medicare eligible recipients. Thank you all so much. This is incredibly helpful. All right, and if we stop sharing that, I'd like to go into the next slide. So now we know a little bit more about one another, the populations that we're serving, the level of engagement that we have experienced with CalAIM. And so before we actually dive into the content for today and actually being very specific about what CPI is, I'd like to just do a couple of introductions. So let me go ahead and move to the chat to see who's here today. First, I'd like to call on some of our partners that will be co-facilitating today. We have the Gashow group that will be presenting later on in today's presentation to actually start working towards developing those shared goals. So Ashlyn or Teodros, please feel more than free to unmute and introduce yourself and what your goals for today's session are.
Hello, beautiful people of Stanislaus and San Joaquin counties. Ashlyn Maloof Gashow here with the Gashow group. And my hope for today's session is that you find it fruitful and informative and that we really begin to build community and partnership with each other. Thank you, Alexis.
Perfect. Thank you so much. And we can also hear from Teodros.
Hi, everyone. My name is Teodros Gashow, along with Ashlyn with the Gashow group. And, I have modest goals for today. I just want folks to feel a little bit more comfortable and knowledgeable and supportive than they did coming in.
Wonderful. Thank you so much. And so I am so excited to see all of these emoji responses that we have in the chat right now. Andrea, would you mind coming off mute just to give a very brief introduction? I see that you have a blue cap, so you are CalAIM Curious, and just letting everyone know, who you are and what your expectations for today's session are.
Yes, good afternoon, everybody. My name is Andrea Weiss. I'm the WIC Program Manager for Community Medical Centers, WIC. I know we have Alfonso Apu, who is representing the medical and clinical services side of community medical centers. But I am here, it's my first meeting. I was highly encouraged by our state, the California WIC Association, to be involved in these meetings as a WIC program. And so I'm just here to kind of take it in. I feel like probably for the last 6 to 9 months, I've been on some meetings with our California WIC Association Board of Directors and listened to some of these words, not knowing exactly how it can affect the WIC program. And I'm even over here Googling, like, what does ECM mean? Some of your acronyms. Yeah, I'm just here to see how WIC can be a part of CalAIM, and I would say probably about 95% of the population we serve at the WIC program in San Joaquin County receives Medi-Cal. So it very much affects the population that we serve. And so I'm just excited. I'm here just to learn more and see how I can partner. Maybe we're doing some things, maybe we can do things better, and just see how WIC can be involved in all of this.
Thank you so much, Andrea. And I just want to beckon back to something that we heard last year. We provided or hosted a panel in Sacramento last year about CalAIM specifically. And there were so many potential providers, potential intermediaries, potential CalAIM partners that said they were afraid to say, hey, what does this mean? And, because we just kept hearing that, we literally have an acronym guide at the bottom of the appendix that we're going to share with you today. So please trust and believe that those acronyms are changing on a week-to-week basis, and we are still getting acclimated to some of those changes. So I really appreciate you flagging that, because it's something that we hear regularly. And I also hope that it's very encouraging to you that, as I look through the chat, I see far more graduation caps than I have ever seen previously. And I also see, more individuals that are wearing the, glasses than we had in past months and past sessions either. So, as these conversations develop and as they continue, we really do want to increase your CalAIM knowledge so that way we can connect the dots as to how we can all coordinate.
Yay, thank you. And I see my colleague Veronica Plower too. She's the WIC director down in Stanislaus. And so I'm excited to partner with her and see how we can do things together in our county. So it's nice to see to recognize names as well on here.
Perfect. Wonderful. Thank you so much. And I will hop over to just two more of our participants. I see a Tammy. Tammy, I see that you have some emoji glasses. Can you please unmute to introduce yourself and just let us know what your hopes for this collaborative are?
Hi, good afternoon, everyone. I'm Tammy Schaff. I'm the Director of Community Health at Dignity Health St. Joseph's Medical Center in Stockton. And I think it's just more information. So I feel like I barely skimmed the top of what CalAIM is, even though we've been kind of immersed in it for several months and really trying to understand. And so getting more information and networking with other people that are struggling to figure this out as well, I think is something I'm looking forward to. So thanks for providing the space.
Absolutely. And I'm so glad to hear that there is this, component of wanting to figure these things out together. We are actually going to provide a little bit of information on what we have heard to date from the registrants, and there's so much commonality. So I just appreciate being able to operate in this shared space where we realize we've been trying to work towards these shared goals independently, whereas we could be doing this jointly, collectively. And so thank you so incredibly much, Tammy. And then lastly, I would like to go to someone that has a graduation cap, because they are very, very familiar with CalAIM at this point. And so I see a Deborah Draves. If Deborah could please unmute, introduce yourself, and just let us know what your hopes for this collaborative are, that would be wonderful. All right, so Deborah might be experiencing some tech issues or may have stepped away briefly. I also see a Sergi. Sergi, would you be able to unmute to let us know a little bit more about yourself and what your hopes for this collaborative are?
Let me see. Hold on, take off my camera.
Oh, that would be great.
Yes, there we go. There we go. My name is Sergey Shkurkin. I'm from EA Family Services, and we are actually in 33 counties. I'm a consultant, actually a TA consultant that has been working with EA and bringing them to registration. And we need to go to so many of these because we're in so many counties that we're just spreading the forces around, and I'm attending on EA's behalf today. We've brought 6 agencies to registration, my group, throughout California. And so I hope we know what we're doing. And I just want to know what this is, what can, I know that EA is an ECM and a CS provider in Stanislaus and in San Joaquin. They're a foster family agency that also works with transitional age youth. We're very interested in the rollout of the populations of focus. We want as much information. We serve over 300 youth in foster care. So we're very interested. So, I'm looking for the most up-to-date information. We want to know, what about community supports? We certainly understand how ECM is going to work for the youth population to focus, but how do you work with housing deposits? So is the child going to be eligible for a housing deposit? How about their parents? So there's, they're working in this program since the very first launch. We've seen a lot of different information. We've seen changing information. We've seen a lot of problems and chaos. We've seen a lot of dysfunction. And so part of it is, sorry, I'm old and cranky, but we need, hopefully you guys have, you're getting information before everybody else from DHCS and the MC before the MCPs. And we want that information because we're going to be going into, homeless was a huge population. The youth is going to be 10 times bigger. And anyway.
No, Sergey, thank you so incredibly much for all of that feedback. And I think that just to validate you, this would absolutely be the correct space to be able to pose those questions. Going back to what I was just referencing towards Andrea, number one, Sergey, the acronym. So you're definitely, reflective of that graduation cap. So you definitely know exactly what's going on right now in this space. And so, yes, but honestly, to follow up on your comments, we understand that there have been challenges, there have been frustrations, and there had not been a specific DHCS sanctioned space for these collaboratives to operate together. Prior to this, there had been TA that had been occurring, or entities were going to various organizations for that technical assistance and that support. And so now we're coming together in this mutually convened space so that way we can address specifically those types of issues. So we really appreciate that introduction and you letting us know specifically what your goal is, for setting milestones and setting goals for this collaborative. All of that being said, thank you all so incredibly much. We can now move into the actual content component of this, of today's session, going back to Sergey's question, like what is CPI? So if we progress to the next slide. Perfect, thank you so much. Before we can actually understand what CPI is, we wanted to make sure that we were able to take that deep dive by explaining how CPI fits specifically into CalAIM. So as most of us know, CalAIM is this long-term commitment to transform Medi-Cal. It's going to do so by offering more equitable, coordinated, and person-centered services. So that way CalAIM or Medi-Cal can now focus on population health. CalAIM is incredibly multifaceted. It's not going to be a one size fits all in order to achieve the goals that CalAIM has to improving population health. So PATH is one of the funding arms of CalAIM. We literally have a picture of a path on the screen for you right now. So you can envision PATH as your path forward to being able to successfully participate in CalAIM. PATH is a 5-year funding initiative. There are multiple PATH programs, and today your seat is being funded by one of those PATH programs, which is collaborative planning and implementation. So going back to what we were just discussing about, what we're all trying to get out of this time together, what CPI is. CPI is a space for CalAIM stakeholders, such as community-based organizations, managed care plans, tribal health programs, county agencies, so on and so forth, to be able to uplift the challenges that they are experiencing within the context of CalAIM. And not only for those challenges to get uplifted, but for us to collectively identify solutions to both contracting and implementation issues in a very supportive space. This is going to be a very authentic space. And later on in today's session, we're going to discuss and uplift how we want to work with one another. And so going back to what I was saying previously, CPI, your seat in CPI is funded by PATH, and PATH is one of the funding arms of CalAIM to make sure that participants can just successfully participate in CalAIM. Moving on to the next slide, we would really like to ask everyone thus far, have you, aside from, participating in CPI today, have you received any other funds, that are a part of CalAIM? Have you received cited funds? Have you received any IPP funds? Have you applied for funds and are perhaps just pending approval at this point? Are you planning on applying for funds, or do you not even know what funds to apply for? If you could go ahead and respond to that question, it would give us some really good data for us to have have to also just support the facilitation, of future conversations that we're going to have. And we'll wait until we have about 50% of participation in that poll to go ahead and reveal some of those results. And I can see immediately that we have, far more entities that are saying that they have received funds than we have in, any sessions prior. Perfect. And if we could go ahead and just share the results of that poll, we have about 8 organizations that have received IPP. We have 0 that have received cited. So maybe we have some issues or challenges with the cited applications that we can uplift with our time together. We see that some are pending approval, and there are still some that don't know what funds to apply for. We are going to touch base on that issue, the not knowing what funds to apply for, as a part of this collaborative, but we would also like to remind everyone that does currently have the slide deck available to them in the chat. At the back of this, at the back of the content, at the back of that slide deck, there are some very helpful links that explicitly explain what funding is available. And you would be able to view the charts that we've created just for you, so that way you can click on those links, and we'll take a deep dive into what those are in a later session. But thank you all so much for sharing the information that you put forward today. Moving forward to the next slide. You now know what CPI is, you know how it fits into CalAIM, but how does this impact you? As most of you that are here with us today know, if you're an organization that has experience providing CalAIM services, or the services that CalAIM now covers, such as housing navigation, medically tailored meals, so on and so forth, you can pursue an opportunity to retain a contract with a managed care plan to provide those services, meaning that you can be reimbursed for those services now. We also understand that we have, the managed care plans in the room. We have hubs and intermediaries, other stakeholders that would coordinate with those funded contractors. So there are multiple ways for you to participate in CalAIM, and that is explicitly how this specific CPI collaborative would impact you. As a part of this funding initiative, you would get brought together with other CalAIM stakeholders to meet specifically for the purposes of identifying those challenges, and for us to collectively develop solutions to the issues that you all are facing. And if we go to the next slide, we'd like to, get a little bit more specific. We've heard from you directly through DHCS, through the registration needs that you provided when you signed up for this initiative, and even from past work that has been conducted, that stakeholders need an improvement in operational workflows and processes. You need to understand how funding can be utilized for you to build capacity. You would like a space to network with other peers in order to learn best practices. You want to develop partnerships that can improve care coordination, so on and so forth. There are multiple things that we have learned back from you all. And so this is exactly why CPI was established, for us to come together to discuss needs precisely like this. And some of the topics that had the highest rate of response so far as the categories within those needs, what those needs fall into, were capacity development. Once again, going back to that funding, how do we use those funds to build our capacity, improve care coordination, data sharing, workflows and systems. These are some of the most important and repetitive topics that we've been seeing from the registrants today that are in this room. So later on in today's session, we're going to head into breakout rooms based on what those needs are, so that we can take a deep dive into another conversation. Moving on to the next slide. So we've discussed what CPI is, how it impacts you as a CalAIM stakeholder, and what we've heard back. But how specifically are we going to accomplish this? What are the actual goals of CPI? Well, there are 3 high-level goals that we want to share with you today. So number 1, we are going to convene stakeholders. Just as I mentioned earlier, we are convening everyone, not just in this facilitative space, but also for you to have peer networking. It's going to be so incredibly important that CalAIM stakeholders have a space in which they can engage one another. So the first component is the actual convening itself. But we don't want to convene without purpose. So moving on to the next goal, we're going to work together to identify challenges. Something that has also been a common theme is that some stakeholders don't know what the problem is. They're trying to put one foot in front of the next, so that way they can connect the dots, figure out who they're supposed to be communicating and convening and coordinating with, so on and so forth. So we're going to work together to be able to uplift and identify those challenges. And then lastly, What are our utmost goals? It's to resolve those issues. We don't just want to identify, we want to make sure that we're collectively working together to resolve those issues through thought partnership, solutions development, and work planning. So that is the purpose of this collaborative. Today, we're definitely breaking down what the purpose of CPI is, but we just wanted you to know and have a very clear understanding of how we're going to spend future sessions together through that convening, through that uplifting of challenges, and through resolving the issues that we identify. And if we go into the next slide, the way that we are going to accomplish those goals is number one, through monthly sessions. So we are going to meet on a regular basis every single month. The first few sessions are going to be in person, but we heard back from some of the participants from managed care plans that in-person convenings would also be incredibly valuable for the participants to be able to say, hey, we have been able to meet in a shared place to be able to work hand in hand to resolve some of the issues that you are facing. So number one, we're going to have those monthly sessions. Number two, co-design is going to be an incredibly important part of this process. We're going to jointly develop guiding principles, i.e. how we'll work together. We're going to jointly develop an AIM statement. We all have very unique needs. So this is not going to be a space in which you come here, we have content prepared and we just facilitate to you. Sessions moving forward, we will definitely take the feedback and needs that you have provided to us for us to develop very specific milestones, very specific objectives, an AIM statement, a project charter, a measurement strategy, so that way we can collectively move forward with being able to not only identify those challenges, but develop solutions, just as we discussed. So we'll be designing what this collaborative looks like together. Lastly, going back to, the goals of CPI, will collaborate to be able to accomplish this. Uplifting your CalAIM experience is going to be one of the most important things that we need to experience shared success. Everyone is going to be expected to, openly participate, contribute to the collaboratives, uplift your challenges, share best practices, and we'll also have satisfaction surveys and just different mediums and platforms for you to share your feedback. So once again, our goals are to convene, for us to uplift challenges and for us to identify solutions. And we're going to do that through monthly sessions, through co-designing what these sessions look like, and by us collaborating to accomplish our goals. All of that being said, I would love to go to the next slide, in which I just want to uplift that prior to DHCS launching this initiative, various stakeholders, you've all mentioned, you've been a part of various meetings, everyone's trying to figure out, okay, like, what is this meeting now? Like, I've been a part of this in the past. There have been prior initiatives that have taken place. A number of agencies were working together to provide technical assistance or to facilitate roundtables to support various stakeholders in navigating not only contracting and implementation, but, just trying to really build those relationships, improve cross-sector coordination. And so we just want to let everyone know that although you may have participated in a prior initiative, that all of the work that was invested in that is not being uprooted. We have been coordinating as facilitator. We have shared lessons from prior initiatives. And so I know it was mentioned earlier that there was, some chaos and some, issues that felt very hectic. We have learned so incredibly much over the past few months about what various stakeholders are experiencing, what your needs are. There have been best practices that have been uplifted. And so we're really taking all of those learnings, bringing them into CPI and moving forward with solutions development with you. And so we did invite the managed care plans here today to provide a very brief introduction about themselves and how they hope to coordinate with you and how we're building upon those past works. But I'd like to start off with having a very brief transition statement from HC2 Strategies. They previously convened the CalAIM roundtables, which a number of you participated in, and they're just going to lay a little bit of the groundwork for how they hosted those roundtables, what the outcomes were, and for those that participated in those roundtables, how CPI is going to continue that work. And so I think that we have Leisha with us here today. And Leisha, if you could unmute and just introduce yourself and let everyone know how we're building upon what you were able to launch last year.
Thank you so much, Alexis. Excuse me, let me clear my throat. Excuse me. So my name is Leisha Smith, and I'm a principal of HC2 Strategies. The managed care plans, HealthNet and the health plan of San Joaquin brought us on in May to start a series of roundtables for those who in the community were interested in CalAIM, didn't quite know, and to provide that space and that forum for them to learn, know, and grow in it. What we did was we created these roundtables as a space where the representatives from local organizations and agencies could come together to hear, number one, about the state's vision to transform California's Medi-Cal healthcare system into CalAIM, which is a whole person care model, to improve the health outcomes, especially those high-risk members of our communities. And the sessions offered opportunities to provide information and updates. It was an environment for learning, understanding, to share ideas, best practices, challenges, and to prepare participants for funding opportunities, such as the IPP, in order to help with the transformations ahead. So along the way, as we had those, the roundtables, we incorporated polls as you're doing today, breakout sessions as you're going to be doing later on the day. So those elements are familiar to those who are joining here. And they were used to help gather important information, to build relationships and partnerships, along with growing participation and partnership with the managed care plans. But most importantly, they laid the foundation for the work to come in the space of the collaborative. The relationships are established, will become stronger. This trusted place for learning now exists, and you can build upon that. And the foundation, the overall foundation to grow from education to implementation to a collective ownership to healthier communities is set. So I would hope that some of the glasses and the graduation hats came about as a result of those roundtables. And we're just excited about going forward and what Health Begins is going to do with this region.
Thank you so incredibly much, Leisha. And then just to reaffirm and validate, we just want to let everyone know once again that all of the learnings that have taken place, over the past year are, coming to an amalgamation. And, DHCS funding this initiative means that we now have, collective feedback from multiple sources that we're able to utilize together for the development and the advancement of those solutions. And so that being said, one of the, important stakeholders that is a part of this process is, of course, the managed care plans. And so the managed care plans also participated in those prior roundtables. And we'd like to give Eliana Argueta from HealthNet a moment to introduce herself to you all and to also provide a little bit of, just aspiration as to what it is that she hopes to get out of this collaborative working with everyone.
Absolutely. Good afternoon, everyone. My name is Eliana Argueta, and I'm one of the regional program managers for HealthNet. My role is to oversee the CalAIM implementation in San Joaquin and in Stanislaus counties. Really, I want to get, to continue to build provider relations. I see a lot of our providers in the counties here. And really, I want to learn directly from you guys, how can we support as a plan the needs for each program and each service. And there's so many services and there's so many questions that come up, but really understanding and learning to be able to collaborate and coordinate different workflows. I know those are some of the highlights that came from other roundtables, and being a meaningful partner in the implementation of ECM and community support services through CalAIM. As many of you, as you are noted in the chat, some of you guys have the glasses on and some of you guys have the graduation cap, and I feel like I'm always in between. There's always so much to learn, and I can only learn that if I know what our providers and our stakeholders also need to learn. And I like growing with you guys. I like understanding exactly where we can come in and support, and also where we can back up a little bit. So I'm very excited to be here. I am grateful for the opportunity to be here representing HealthNet. All my information, I believe, is on the slide. So please, anyone, if you have any questions, please reach out to me.
Thank you so much, Eliana. And we would also like to hear from Cynthia Pena, who would be the representation from the health plan of San Joaquin.
Hi, good afternoon, everyone. My name is Cynthia Pena, and I'm a director under the operations area at the Health Plan of San Joaquin. And I'm happy to be joining you this afternoon and really working towards this collaborative planning session. I think it will allow us to build on a lot of the additional collaborative sessions that we're participating in, including, the California Healthcare Foundation, and really as that those steps initiated, as well as our roundtables, and then really offer an additional forum. Now, a year past our implementation, that will allow us to learn much more and engage an additional group of stakeholders. So I'm happy to join and happy to represent the Health Plan of San Joaquin. Additionally, we will have other team members joining as well, but looking forward to these discussions.
Wonderful. Thank you so much, Cynthia. Thank you so much, Eliana. Thank you so much, Alicia. We really appreciate your partnership in all of this and making sure that those lessons are moving forward so that way we can support and advance this collaborative in a way that's going to just be incredibly meaningful. Moving forward into the closing slides of our first section, I just wanted to briefly share a few key takeaways. And so if we go to the next slide, I just wanted to share a recap of what we've discussed so far. Number one, CPI is a space for CalAIM stakeholders to convene to identify challenges and to uplift solutions that will support CalAIM contracting and implementation to make CalAIM a success. Number two, we will collectively determine participant priorities and goals, specific to your organization's needs. And over the next year, we'll work together to achieve them. And lastly, CalAIM links and the CalAIM roundtables are coming to a close. CalAIM links, just as Cynthia referenced, was the work that was sponsored by CHCF that we at Health Begins led over the last year. There were so many amazing learnings and takeaways that came out of that work that we're going to invest and put forward into this current work. And so the meetings that we held last year, the sessions, the TA that was provided, it's all coming to an amalgamation into something wonderful that can serve as a foundation for the CPI initiative. And so that's something that's really important for us to uplift. When a lot of the initiatives were started at or launched at the start of 2021, we didn't have all of the feedback that we had, for this. We didn't have all of the learnings, the lessons, the challenges that have previously been identified. So taking all of that information, we just have a really great foundation upon which we can work together for this specific initiative. Before we dive into developing our shared goals for how we're going to spend this time together, I would like to just have a very brief Q&A to ask, do you have any questions about the background of CPI and its goals, how it impacts you, how we'll work together over this next year, or the program transition? So we just wanted to take a few brief moments before we start developing those shared goals, just to see if there's anything that, I could re-uplift, any questions that you have, or anything that you just need clarity on. And I can also put forward a question to the group. Is what has been presented today meeting expectations of what you presumed CPI was going to deliver? And you can either unmute to share, your feedback about the assumptions that you had coming into this today, or you can also feel free to use the chat. I would love to know, is it on par with what your expectations were? All right, so I see we haven't received any feedback just yet, but it's okay. I know that we have additional time for Q&A. So what we can do now is dive into part 2 of today's conversation, in which we're going to develop some shared goals. So excited to hand this over to Ashlyn of the Gashow Group, and she is going to put forward a few activities for us to work together to define some very specific goals.
Thank you, Alexis. All right, everybody ready to roll up your sleeves? Take yourselves off mute, maybe even show your beautiful faces. We're gonna dive into a few different exercises. The first thing that we want to do is establish our group norms and agreements with each other. I really love what you said, Leisha, about it being a trusted place for learning, that the work that's been done so far has really established a trusted place for learning. I want you to think about, what are some of the agreements or norms that you've experienced in the past on a team that you've been on, a collaborative that you've been on, that have really helped you show up as your best self, and also what's going to support us in reaching our goals. The screen is going to share a Jamboard. Now, I know you all have probably been a part of meetings where everyone was asked to go to the Jamboard. We are not going to do that today, because if you've experienced that, it can get a little off track. Instead, what we're going to do is we're going to share the screen, just a moment here, that shows the Jamboard.
One sec, pulling that up.
Thank you so much, Shifa.
Sorry, it takes 1
Or
second.
just fine.
Cool.
Okay. And I'm going to ask you to come off mute, or as a backup, put it in the chat, but I would really love to hear your voices come into the space about, again, what are some agreements or some norms? So a couple of examples are the safety to ask questions, or maybe to be real and say, I have no idea what that acronym you just used meant. Or, you know, when in doubt, ask for clarification. This space is really for each of you. And so we want to make sure that you have the time to get the clarity and the support that you need. Those would be examples of some agreements. So if somebody's willing to come off mute and share. My dog clearly wants to share. Apologies for that.
I guess I'll go first. Well, in any type of learning new information, it has to be fun. You know, I would say that's the best key to it. If we are going to learn something, let's have fun about it. Let's not be afraid to laugh and have fun, because I believe that's the best way to learn new things.
Love that. Thank you, John. Yes, room for fun. We will make sure that is incorporated. Hector, please.
Good afternoon. This is Hector Medina, and I'd like to share that the willingness to participate and share your experience to the rest of the group is very pivotal for us as well. Every county is different. They operate in different means. So we've seen in the past that the more you share, the better the whole group becomes.
I really appreciate that. Thank you.
This is Leslie. I would also add that I think what helps me is when there's just kind of a mutual understanding that everyone's giving each other the benefit of the doubt, right? That we're all trying to kind of do right by our constituents.
Really appreciate that. Yep. Assuming the best of intentions. Yeah.
I would also like to put forward for Pauline, you know, just this mutual trust. I know that it's been our experience over the past year that sometimes participants are, they've literally vocalized, you know, in private settings, like being afraid to say, you know, this is what we're experiencing. You know, we might receive a slew of questions in the back end, a slew of feedback, you know, in the registration. But, you know, coming into the actual learning environment can be very intimidating. So I think that, you know, for all of us as, you know, conveners and facilitators, it is our goal to create a space of trust in which it doesn't matter what the question is, it doesn't matter what the challenge is. In addition to us being able to operate in this collectively fun environment, which I am going to +1, you know, to the fun, I just want everyone to know and recognize that we are putting forward this space of trust, so that way we can, you know, have just an incredibly authentic process.
Thank you, Alexis. Yeah. Yeah, this is a place for learning, not judgment. Yeah. Let's hear from one or two more.
I think it's important. I mean, it's really important that everybody be really supportive and people feel safe. But at the same time, recognize the real dangers that are in a situation like this. Particularly if MCPs are here. Ileana, we love you. We love all my, I love all my MCP contracts. But I think an honest, recognition and effacing of it, because it'll be important for us to get our work done, that there is a different, there are opposing interests with the state and the MCPs, and particularly those of us that have been on the front lines advocating for the homeless for decades. You know, we're used to advocating for our clients. We're fighting for our clients. We sue the cities with legal aid. We're in court. We're ensuring for benefits. We fight for benefits. A lot of us have, been fighting for benefits for our clients. It is the job of the MCPs to guard and the state to do what they can, but they also have a fiduciary function to make sure regulations are done and that money is spent correctly. And as one MCP told us, they're protecting the taxpayers. It's not the culture maybe here but I come from a little bit of a different culture, a little more direct, everybody Russians, but but there's a value to that, because it helps get things done and really get significant, important things done, because we don't have to be, we just work together on that and come up with a middle ground, but be open, but not avoid difficult subjects.
I really appreciate you for naming that. And a part of how trust is built is through directness and is by putting it on the table. And so I appreciate that. It's also taking me back to one of the first slides that Alexis shared about all of us being here out of a care for people and out of a care for the recipients of Medi-Cal. So I think we can also do our best to center that and recognize, that different organizations and institutions have different ways of doing that. But I appreciate your directness, and all of you is welcome here, my friend. All right. Any last thoughts? All right, I think we're ready to keep moving. So just to recap this, safety to ask questions, clear and easy to understand information, the willingness to share your experience with the rest of the group. The more we share, the better we become. Be open, but don't avoid. Mutual trust, learning, not judgment, supportive, safe, and honest about the different interests of participants, a space to connect with other organizations, mutual understanding to give one another the benefit of the doubt, to assume the best. And fun +1. I think that's what Alexis said. She's +1 for fun. So I think that should be our opening motto. All right, if we could go back to the slide deck, please. Thank you, everybody, for your input.
Sorry, we're having some technical difficulties. Give me 1 second.
We have all been there.
Awesome.
All right, we can go to the next slide. Great. So we've all said there's a whole lot of information that we are all working to digest. Okay, so I think it's helpful to do another refresher about what is CalAIM. Right, CalAIM is about transforming Medi-Cal by offering a more person-centered approach to improving population health. This includes expansion of services and bringing in new providers to the Medi-Cal landscape. So what are the primary goals? It's to manage comprehensive needs by recognizing a whole person approach that takes into account the social drivers of health. We know that when somebody doesn't have access to housing or safe, healthy housing, it impacts our health. We know that when somebody doesn't have access to healthy food or transportation to get to healthy food, it impacts the person's overall health. Wanting to improve quality outcomes, to reduce health disparities, and to drive the transformation of the system through our values. I love that. And to establish more coordinated, seamless, and cost-efficient system for Medi-Cal beneficiaries. So who can participate? All of you here today, on-the-ground partners, community-based organizations, public hospitals, county agencies, and tribal health programs, to name a few. As an enhanced care management or community support provider, you get to participate in CalAIM. You can do this by contracting with a managed care plan, providing services, and meeting the requirements outlined by the plan and by DHCS. Okay, we spoke before about acronyms. We're back again. Community supports, just formally ILOS, are medically appropriate, cost-effective services that can be offered in lieu of traditional Medi-Cal benefits. Community supports are not required. They're strongly suggested, and they're also optional to offer and optional for the member to accept. Enhanced care management, ECM. It's a transformative Medi-Cal benefit that uses coordination of health and health-related services to address the clinical and the non-clinical needs of high-need beneficiaries within specific populations of focus, okay? So, in other words, people who have a high level of needs, there are gonna be multiple ways to meet those needs, okay? So how do I become a provider? By contracting with a managed care plan. And in future sessions, we're gonna be talking about supporting you all with challenges that relate to the contracting and the implementation process of this. Okay. So poll number 3, I don't know about you, but I love these polls. All right, poll number 3, if you are an ECM provider, which populations of focus does your organization support? Individuals and families experiencing homelessness, high utilizers, adults with serious mental illness, substance use disorder, incarcerated and transitioning to the community, at risk for institutionalization and eligible for LTC, nursing facility residents transitioning to the community. And when we have 50% response, we will share the results of the poll. In the spirit of fun, we could all come off mute and do a drum roll. Should we do it? 1, 2, 3. Hey! You all left me hanging.
I did not leave you hanging, Ashlyn. I did it.
All right. Thank you. Okay. 93% individuals and families experiencing homelessness, 67% high utilizers, 73% adults with serious mental illness, substance use disorder. Yeah. So you can see here the incredible work and communities that your organizations work with. Thank you for your work. Let's go to the next one. Okay, if you are a CS provider, which services do you provide? Housing, short-term, post-hospitalization housing, recuperative care or respite services, day habilitation programs, nursing facility transition, environmental accessibility adaptations, medically tailored meals, sobering centers, asthma remediation, homemaker services. right? All right. Yeah. So very large majority around housing services, probably not a surprise to all of us here today. Yeah, short-term hospitalization housing. Thank you. Really appreciate you filling out these polls. Let's go to the next slide. All right. So now you all get to talk with each other in breakout rooms. The goal for the breakout room discussions is twofold. It's to really define our project charter and our aim statement. What does that mean? The project charter is a document that we are all collectively designing here today through our input that states how we're setting out to achieve and how we will measure success and the timeline we want to achieve it in. The aim statement is specifically about what we will have accomplished by the end of this collaborative as a group together. And we're going to give you the option to go into 2 breakout rooms, breakout room A and breakout room B. Okay, breakout room A is when you named areas that you would like more support in, you would like to have more learning in. If you chose capacity development or improved care coordination, we want you to pick that group. If you wrote data sharing, workflows and systems, we want you to pick that group. We also want you to know, we know these 4 bullet points are not comprehensive of all the learning goals that you all outlined. This is merely a way for us to choose which beautiful group we're going to be in. Okay. So you should get a pop-up. And then if you are in breakout room A, you will be with myself. And if you are in breakout room B, you will be with Teodros. And yes, we will share the data poll information. Thank you for the comment in the chat.
I'm so sorry, Ashlyn. How do we go to the breakout rooms?
You should be getting a pop-up soon that is going to allow you to choose.
Oh, okay.
Is that correct? That is not correct. So click on breakout room at the bottom screen. And then choose to either join A or B.
Like where you're sharing the screen?
At the bottom of your screen where it says.
Oh, I see. I see. Thank you. Yeah, thank you for your patience, Ashlyn.
No, you're fine, Leslie. You're good. Any other questions before I move to breakout? Okay, see you soon.
So I don't think I have anything that is asking me about a breakout room, unless it automatically will put me in it.
So if you look at your toolbar at the bottom, do you see where it says chat, share screen?
Mm-hmm.
Do you have a one that says breakout rooms?
I don't.
Don't. Okay. And that's as far as my technical expertise goes.
Well, that's okay, I guess. So are we just sitting here until they come back? Because I could ask Cynthia some questions, right? You're from Health Plan.
Yes. Hi, good afternoon, everyone.
Hi.
Yeah, I think I'm just waiting to see if there's another, prompt or specific questions that pop up, but.
Oh, okay. Yeah, so you'll still be in this space here?
Yes.
Oh, okay, so if I could, maybe I could ask some questions.
Sure.
I am working with the San Joaquin Community Foundation, and establishing the Pathways Community Hub. And so I was invited, this was forwarded to me, so that could be why I did register, but it was asking some questions, and because I don't really work in these spaces, so I couldn't answer some of their questions, right? But I know that we do want to partner with HealthNet, and we do want to look at ways that we can you know, have a very strong foundation for CHWs. And if you've worked in any of that space, know that it's just beginning. And so there's a lot of things that aren't set. But I wanted to know if, you know, if that's a space that HealthNet is already fully involved in, and how we can on a bigger level maybe partner to look at CHWs as a workforce initiative for our Black and Brown communities, and kind of lay that foundation as we're building this Pathways Community Hub for that.
Sure. And I just wanted to clarify. So I represent Health Plan of San Joaquin. Eliana is from HealthNet. So I don't know if you have any, you know, questions that are specific to the plan, but I can tell you for CHW services, it is a Medi-Cal covered benefit now. And there is, you know, new guidance related to the requirements and the parameters of it. And, you know, we'd be happy to, you know, maybe take some additional questions offline if you have any for the Health Plan of San Joaquin. But I know, you know, there are different opportunities for CHW services. They can be part of ECM, of that care team as well. And then again, as I mentioned, there's a separate Medi-Cal covered benefit for CHW services. So there's opportunity there to, you know, develop potentially some opportunities there.
Oh, absolutely. And so we would be addressing, since it's very interesting that for this space, we only have HealthNet and Health Plan of San Joaquin. Obviously they can handle the load. It just seems like you need more support, you know, in that space. But we would be looking to engage with Health Plan. I assume this is all new, but engage with Health Plan and HealthNet, because ultimately we just want to maximize our impact. So if one, you know, not trying to burden one with the whole solution, I would guess that it would make more sense to kind of split it out and make sure that we can help as many individuals as possible. With health plan, are there specific, I guess, specific specialized areas that you're focused on? Like, and this is me mixing CHWs and CalAIM, but when I look at it, they generally are like asthma. And I think you know that for our area, it's Black maternal health, and that is a focus for Health Plan. So wondering if that is a segue or a road into this opportunity that you had just mentioned, is us focused on the same thing and kind of working together.
Sure. And as you mentioned, Nadejda, it is very early in the, you know, CHW as a covered benefit. As I mentioned, they are part of ECM currently. So I think, you know, really the focus is going to be on all disparities and as we work to identify them. But I think, you know, would be happy to partner with you and follow up if you have any questions. Maybe perhaps Eliana and I and myself can help address some of the questions if you want to send us an email or afterward.
Absolutely.
I can say, this is Carlos, we've used the CHW program kind of as a pilot in more rural counties, San Bernardino, Riverside, and it's worked great. Especially with our behavioral health and ECMCS, it's great. My only kind of question mark will be interesting to see is what certification program the state's going to come up with. That's my only big question mark, because I know they're saying they're going to come up with a certification program. Right now, I know it's lived experiences is how we're getting CHW staff under that criteria, but the certification is the big question mark for us.
Oh, okay. Actually, I would love to connect with you if you could share your information. I think it would
Sure,
be
I'll send it to you
helpful.
in the chat right now.
Oh, okay, thank you. I was wondering about that certification as well. And with your pilot, how do you ensure, I guess I was in a training because we have like a first cohort of CHWs here that we're working with, and they're in training right now. So I took some of that training, but was a little concerned that what if that CHW is with this lived experience and trauma is helping someone else, and their trauma triggers this CHW.
Well, see, that's the good thing with us. It's because we have them reporting to two. They're under an RN, but also a behavioral health licensed therapist. So they have to also go under the thing that helps us. We had them. It's a free training. It's called mental health first aid, and it helps them identify some of the traumas and also some of their own triggers. And
okay.
and some of the times too, it's up to them. We provide them free behavioral health therapy. So we give them therapy not related. So that's some of the things we provide on our end to them to make sure, hey, you're taken care of as well as an individual. But the mental health first aid too is kind of helping them figure out the triggers and not have what we call co-transference. So it doesn't, hey, oh, that's triggered me. Okay, oh, right. It's to keep what I'm doing separate from what triggered me. So hopefully, but the mental health first aid, it's a free training and we swear by it. We even have our ECM and CS staff go through it too.
That's great. Yeah.
It's provided by the National Council for Mental Health Wellbeing. It's a free training. And they get certified, which is a great thing for the staff too.
Yeah, that's great.
We're kind of, I hate to say this, we're the old kids on the block. We've been doing ECM and CS. Oh, this is our third year. We did it when with health homes. So we're kind of like, I mean, we're in, I think, the 28 counties, if you can believe it.
Oh, okay.
So we're happy to help. I mean, we just see this as it's great. We love seeing all the great agencies and we're just happy to help it wherever we can, because this is the future of healthcare. This is such a needed right. It's been needed, and it's great that California is finally the one state finally taking the leap. So
I agree.
It's great.
Absolutely. We've been missing this human touch the whole time. And I really think that with the funding in the right place and the CHWs, or like titles, because they're called all kinds of things, health ambassadors and such, but they are like the hands and feet. And I think, working on building this Pathways Community Hub for these CHWs, it would be in our interest to lay a really solid foundation of showing the importance of this new position. And when I say new position, I mean new position being more broadly recognized for its value, to make sure that comes across, because sometimes I think the funding or the pay structure for it doesn't necessarily represent that right now. like
Right.
it being reimbursable and stuff. And so I think it needs, it deserves some more conversation about how to make this, because it ultimately, it's a career potential for our Black and Brown communities that have historically been unserved or underserved or left out, marginalized, and their help, it's the community helping the community, right? So it's going to be sustainable.
Well, and it's a lot more palatable by the community because it's the community serving the community.
Absolutely. So there's where we get our huge success,
Right.
In the actual model of how it's going to work. But how do we maintain that? How do we keep people there? But also, how do we grow? Like, how do we get these same people who are getting this job, who haven't had this opportunity before? How are we getting them to have a livable wage job? And there's opportunity to turn this into a career pathway to where CHWs then could potentially go for higher education, become MAs, and then go into other
Or a therapist.
health
We're
care.
sponsoring
Right.
a couple to be therapists already.
Right. And so it's building that out though, so that it's a whole pipeline. So then you start impacting poverty and other
Right.
things. And long-term, now you're building, you're laying a foundation so that generational wealth can be built. And there's opportunity to partner with, in our county, I'm in San Joaquin County, there's opportunity to partner with the colleges like UOP, and they have programs for first generational college students, which is perfect for the same demographic of who have not otherwise had opportunity to go to college. But now that's kind of the segue into them getting that higher education and getting that livable wage job.
I agree. I mean, and it's a great thing that we're finally getting to this. I mean, my only fear that's coming right now is what's going to happen to a lot of these members now that we're getting close to the emergency waiver being waived. What's going to happen now with the now they're going to have to go back to providing Medi-Cal and a lot of the MCPs with the paperwork needed to maintain their eligibility for Medi-Cal. So we're working with DHCS to be the ambassadors. So that to me is a big thing to try to keep people's insurance maintained too.
Oh, okay. So I haven't really got into that piece of it yet.
Yeah, people, because right now with the waiver, it's with the waiver, they don't have to maintain any of the paperwork they had to do before for the last, 2, 3, almost going on 3 years.
Mhm.
So once the waiver is kind of let go, they're going to have to go back to maintaining, proving income, providing whatever it may be. And Cynthia can probably add more than that to me. They're going to have to provide all those informations back to maintaining their insurance. So that's a big thing. And we've been working with DHCS as trying to be ambassadors to trying to help these members maintain the insurance and maintain their eligibility to stay on Medi-Cal.
And so we haven't built anything over the 3 years. We haven't built anything so that this transition would just sort of automatically happen where people would
Not really. I mean, that's why we're working with DHCS on the ambassador program to kind of like, hey, can we as ECM and CS providers kind of be the bridge and the conduit? Because a lot of these members, again, if we've got them on the phone, let us be the conduit to working with the MCPs, working with the state and saying, hey, if we've got the member on the phone, let us be the conduit and call the MCP or the Department of Medi-Cal Services and let us do whatever paperwork that needs so we make sure the member doesn't lose their eligibility. So that's been the biggest, that to us is the scariest thing, because then if the member doesn't have insurance, this whole thing kind of becomes moot.
So yeah, so I think when you and I talk, I might be able to get some more detail about it, because I just have little pieces from just what you've said so far. But I'm missing, I think, where where we wouldn't just have a system that transitions them into a system that can now do this work that you're saying needs to be done on paper.
Well,
Is
it
that
is on
part of
paper.
like
It's-
electronic health record, or is that
Right.
something that the HIE, like a health information
Well,
exchange would?
unfortunately, they have to give us verification of income.
So the employee, or I'm sorry, so the patient has to give you verification of employment.
Or verification of income or something like that. Yep.
Oh, okay. Yeah, so we'll connect
Yeah.
offline. Thank you.
That's the best sign that a breakout room has been rich, when people come back and continue the conversation. I love it. We're going to give just a moment for the rest of breakout room B to join us. And given where we are on time, John, you might be off the hook. You might get to just put it in the chat after all of that.
Hi, so group B just came back. We kind of got cut off in the middle of a comment there, but we're gonna have some time to reflect and discuss between both breakout groups right now. So folks will have still have an opportunity to share and speak.
Great. All right. So we're not going to have a lot of time to share and discuss, because we want to make sure that we get you all out on time. So what I'm going to ask is for the two people, breakout room A and breakout room B, what are the top 3 things that you remember that you heard? Anything else? Go ahead and put it in the chat. So let's start with breakout room A. Go for it, John. John?
Well, I think I can just speak real quickly. So I think breaking down the silos was one of them. Being able to be very informed from all aspects, from the managed care plans all the way down to who provides ECM and who provides community supports, all that information to be readily available, kind of have some uniformity in that, it sounded like, was all information. And then I think the best part was no longer having that meeting after a year, and then looking to other groups that maybe expand on what we've learned, and maybe will expand that group into something different, make it form into something better, bigger and better.
Thank you, John. Group A, give them some love. All right. Yes. Group B.
So I just have to apologize for, Group B. We were just having such an engaging conversation that we did forget to assign someone to speak on our behalf. I kid you not, we were really engaged. And so out of Casey, Leslie, Veronica, Andrea, does anyone want to just uplift, 3 just major takeaways that came out of that dialogue?
I can give it a shot. This is Casey.
Thank you.
I think we were really looking at workflow systems and processes, and we talked about the overlap and how important it is in mindful care coordination with limited resources, that everyone really understands their roles, how they pass clients along, and how we work collaboratively together. We talked about the importance of having information sharing and the ideal of having some kind of universal informed consent, where if you are enrolled, it means we can work together. We also talked about capacity building for the boots on the ground folks so that they were easily able to become partners of the managed care plans, well understood what they could bill for and how to bill for it and how to demonstrate results. And all of that was easy and simple enough and supported enough that it didn't take away from their primary work and objectives of delivering services. We did not take notes well, but if anybody else wants to jump in from Group B.
Yeah, I mean, I have all of the notes on the back end, and I just definitely +1 everything that Casey stated, with just so much emphasis on the sustainability of funding, and data share was just a huge topic, a major topic. And so it's just really exciting for us to see how specific our milestones are going to be, and just getting excited about the models, you know, and proven practices that have worked, to be able to actualize some of these objectives. And just, you know, looking forward to how we're going to translate our goals into some very specific work planning. This is great. This is so wonderful. But yeah, I'll definitely pass it back over to Ashlyn to close us out. Can't believe this time has gone so quickly.
Yes, good work, good work, everybody. My job is to get us out on time. So we're gonna cruise through this next part. As a recap, we went over that the goal is to really improve understanding, made some guiding norms and agreements together. We spent some time on the charter and the AIM statement, and we had a few minutes together to reflect. Based on the results of the breakout sessions, a formal AIM statement and project charter will be developed, and then we will share it out with all of you to see. Next slide. All right, let's talk next steps. Okay. Next month's session is going to focus on work planning. Hey, let's all get excited about that. You'll receive a post-event email, which is going to have an assessment. Please make sure that you register using the link for the February session, and let's network. We're going to share a networking platform. I already saw people exchanging email addresses, asking folks to follow up with them. I love it. Y'all are so good. The slides and other materials are going to be provided via email, so we will get that to you if you are not able to download it. Any questions, contact the amazing Shiva, who has been helping us this entire meeting, and help us spread the word by getting other potential CalAIM stakeholders in the room with us. Next slide. Okay, everybody come off mute and be ready to give lots of appreciation to the Health Begins team. Dr. Rishi, Sadina, Alexis, Melissa, Shiva, this is the dream team right here. They do an incredible amount of work to make sure you all have the best experience possible. So off mute.
Hey.
All that love. Thank you, team.
Thank you.
All right, next slide. The Gashow Group, thank you so much for allowing us to be in this collaborative with you. It's a real privilege. So appreciations, Teodros and Pauline.
Yay to you guys too.
Yay. Thank you, Casey. All right.
Yay.
Next slide. Next slide. In the deck, I just want to point out that at the very end, there's going to be a number of resources available to you, including key terms and acronyms. Let's just go ahead. Yep, there you go. Other important documents. And there will be links included in all of this to make it simple for you, funding opportunities, etc. So our time is up. Appreciation for each of you and taking the time to be here. And we'll see you next month.
Thank you all so incredibly much. Thank you so much. Have a great day,
Have a
y'all.
wonderful day.
Bye.
Thank you. Have a wonderful day.
You too.